Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
Jeffrey T. is a 27-year-old man who is presented for care after being required to do so by the county court. He was involved in a car accident, and while he was not at fault for the accident, routine blood alcohol screening revealed that he was driving while intoxicated. He is a bit resentful at being required to attend therapy. He is very vocal that his driving was not impaired and that he is able to function normally even after drinking what others might consider excess amounts of alcohol. His wife actually confirms this. They both admit that what began as 1 or 2 beers after work a few years ago has evolved to where he now drinks at least a 12-pack of beer nightly. Regardless, they both confirm that he never seems drunk and that this does not interfere with his job or fulfilling his family functions. Jeffrey's ability to function normally, despite high blood alcohol level, is likely a result of A. Dependence, B. Abuse, C. Adaptation, or D. Addiction. So again, remember what the question is asking of you. There is a long scenario here, and it sounds a little iffy, but the question for you is Jeffrey's ability to function normally despite high blood alcohol is likely a result of, and the answer is C, adaptation. Now, I'm not in any way suggesting that drinking a 12-pack of beer a night, the patient can remain normally functional, but our role in this question is to review these terms, all of which apply in one way or another to an alcohol or other substance use disorder. But again, remember to look for what the question is asking you. And the question at the end of this whole scenario, the question for you is, Jeffrey's ability to function normally despite high blood alcohol is likely a result of C, adaptation. Adaptation is the correct answer. Cellular or pharmacodynamic adaptation refers to the ability of the central nervous system to function despite high blood levels of the substance of abuse. Now, again, I'm not suggesting that anybody can function normally after 12 beers, but that's not really the question here. The question is, Jeffrey's ability to function normally despite high blood alcohol is likely a result of, and the answer is adaptation, because after repeated exposure, the central nervous system does adapt to some extent. The human condition is nothing if not adaptable. Dependence refers to repeated use of a substance with or without physical dependence. Dependence can certainly be psychological, but dependence refers to repeated use of a substance with or without physical dependence, but does not specifically encompass the concept of functioning normally with increased doses. Dependence is just whether or not you need it from a psychological or physical perspective. Abuse generally refers to using drugs or alcohol in a manner deviant from societal norms, and while Jeffrey may be doing that, that's not what explains his ability to seemingly function normally despite high blood alcohol levels. And addiction refers to a situation in which deprivation of the substance produces distress and mental or physical deterioration, something also not described in this scenario. So the real takeaway here is that while all of these may be present for Jeffrey, he may have a dependence on beer at night, he may be abusing it, and he may be addicted to it. But adaptation is what we are talking about when we're talking about someone's ability to function normally despite high blood alcohol. Now, whether or not he really is functioning normally or not, that's a whole another concept. This is a great question because it can start to take you down multiple paths and you start thinking, gosh, all of these could be right here. If he's drinking that much, he probably is dependent on it. He is abusing it and he's probably addicted to it. And all of those things may be true. And that's when you have to bring yourself back and really focus in on what the question is asking of you. When all is said and done, Jeffrey's ability to function normally despite high blood alcohol is likely a result of adaptation.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.